My name's Hillary Wright. I'm the Director of Nutrition for the Wellness Center at Boston IVF. And a big part of the work that I do for Boston IVF and have for many years is to help women with Polycystic Ovary Syndrome or PCOS optimize their health and fertility by embracing the diet and lifestyle strategies that we know can make a difference. I've heard heartbreaking stories from women that are told at a very young age that they may not be able to have children. And I can't even imagine doing that. Particularly to a young girl who's just kind of thinking about those things, when the reality is PCOS is a very manageable condition. Diet and lifestyle is a primary treatment, but there are a lot of fertility treatment strategies that can help to additionally improve fertility outcomes for women with PCOS. So there's always reasons to be hopeful about fertility, even with a PCOS diagnosis. So probably the primary treatment, the big attention getter, is the lack of regular menstrual cycles. So it's clearly not normal for young women to not have menstrual cycles. And sometimes I think people don't really understand that because they may know other people who've not regular menstruators. So that is a really significant sign that something is amiss with your hormones. Also, women with PCOS frequently experience hirsutism, which is excess hair growth, often in the face, other parts of the body where it's not wanted. They can also, as part of that whole hormonal alteration, start to lose hair on the crown of their head. So it's really these changes in hair growth and the lack of regular menstruation that is a big red flag. So we've known about what we now call PCOS for over 100 years, but it's only been since the 1990s that we've come to realize that what's going on behind the curtain in most women is a condition called insulin resistance. So in insulin resistance, it means that the body makes higher than perfect levels of insulin in order to regulate your blood sugar. But insulin is a hormone, and higher than perfect levels can start to noodle around with your other hormones that need to be perfectly balanced in order to give a woman's body a monthly opportunity to ovulate and conceive. I mean, the interesting thing, in my book, The PCOS Diet Plan, I talk about how to manage insulin resistance with diet and lifestyle strategies. And many of the reviews have been, wow, isn't this how everybody should live their life? And that's actually true. So much of what we're talking about in general for good health, plant-based eating, which does not mean you need to be a vegetarian, but trying to, make that extra effort to eat more fruits and vegetables, try to opt for whole grains as much as you can, and then be mindful of how much carbohydrate we're eating at one time, because it's carbohydrates that show up as sugar in your blood, which triggers the insulin response. So there's a lot of misinformation online where women think, oh, that means carbs are bad. Actually, that's not true. It's all about the quality and the quantity. Where are the carbohydrates coming from? How much are you eating at once? So to focus on healthy carbohydrates, spread them out over the day, pair them with a little extra protein to help fill you up, and then really making that extra effort to get at least 2 servings of fruit, 3 servings of vegetables. Those basic tips can go a long way towards managing PCOS. Physical activity is also really important because when we're active, we trigger the production of proteins in our cells that help our body lower our blood sugar naturally. So, which I always say that's why 100 years ago, diabetes was a rich person's problem because everybody else's life was very physical. Also, building up muscles is really important because muscles are big glucose sponges. So it's really understanding how these diet and physical activity strategies, along with, doing what we all should be doing, trying to get enough sleep, socialize with other people, manage your stress. But having an understanding of how that could actually change your hormones can be a game changer in my experience. So I think it's really helpful for women with PCOS to understand that the things that I would suggest they do to help manage their health and improve their fertility are perfectly healthy strategies to continue on through pregnancy and beyond, because women with PCOS do have higher risks of chronic health problems like diabetes, cardiovascular disease. And so the same things that can improve your fertility can lower your risk of diabetes if you really embrace them for the long haul, as opposed to just trying to jump on to conceive. A lot of times with PCOS, the emphasis is on weight loss. So there's a misconception that all women with PCOS are overweight. And so we know that it can be easier for women with PCOS to gain weight, and it may be more difficult for them to lose. But we also know that there's a variant called lean PCOS, women who are not overweight but still don't get regular periods and may have facial hair and some of the other elements. So both of these groups are known to have increased risk for insulin resistance. The lean woman with PCOS is probably going to be less insulin resistant. But I think it can be overwhelming for people to try to think about weight loss prior to fertility treatment, particularly if the clock is ticking. So I always encourage people to the best of their ability, try not to hook the healthy eating and exercise caboose to the weight loss train, because we don't know what that will take in the long run. And solely focusing on that can prevent women from really experiencing some quality of life boosting, mental health supporting, energy providing, healthy diet and lifestyle strategies that are going to benefit them no matter what is going on with their weight. So I think that Boston IVF is unique in that I don't believe most fertility centers have a dietitian who actually is part of the team. So I think that makes us unique. I consider the work that I do with my patients to partner with the physicians here, who I'm trying to help them with sort of the organic side of the equation, with the diet and lifestyle piece, while they're doing what they can to kind of try to balance hormones and offer treatment plans that can, progressively result in pregnancy depending upon the person's individual circumstance. So it's really a partnership of sorts, and that's the way diet and lifestyle should always work alongside medical care. We live in a country where we like to kind of take drugs to fix all problems, and we now understand better that ideally we would support people in their diet and lifestyle goals, not to say that's always easy, but really support people in that arena to increase their odds of success with the medical management piece. So my book is called The PCOS Diet Plan, and first came out in 2010, and then I revised it again in 2017. And it really helps women understand the conditions so that they then can appreciate why I'm making the kind of diet and lifestyle recommendations I'm making. Information about the book and the website for the Wellness Center and Boston IVF will be in the description.